The number of coronavirus deaths in the U.S. have now topped 150,000 people. More than 4.4 million cases have been confirmed in the country so far. Texas, Florida, and California reporting a record number of fatalities in one day. And we're now getting this warning from the White House Coronavirus Task Force. Coordinator Deborah Birx saying that she's starting to see an uptick in cases in Kentucky, Tennessee, Ohio, Missouri, Kansas, and Nebraska, consistent with what we heard from Dr. Fauci yesterday, and Wisconsin mandating masks, declaring a public health emergency a short time ago. Let's bring in Dr. Uche Blackstock. She's Advancing Health Equity CEO and a Yahoo News medical contributor. We've also got Anjali Kamlani, who covers the space for us. Dr. Blackstock, it's good to have you on today. Let's start with this news coming out of Wisconsin, because it seems like every time there starts to we start to get a handle on one state, there's another state that pops up. And now we've got this public health emergency in Wisconsin as well. When you look at what's happening in its totality, how do we get a handle on this?
Right. And this is no surprise. Viruses know no borders. And so they're going to hop from state to state, and especially with the traveling during the summertime, it was almost predictable that we would see this. And so, again, I can't reiterate more that there needs to be a national strategy. Not saying that every state needs to shut down fully, but those states that are in the red, that are having surges, will likely need to shut down. And we know that just wearing masks is not enough, and physically distancing is not enough. And so I think those Midwestern states that we see now that are increasing, we should really consider stricter restrictions.
But to your point, there are no borders. So does it make sense for stricter restrictions in one state and letting off in another? I mean, we haven't had a federal cohesive policy in place. Do we need a reset, the kind of reset that Dr. Fauci's been talking about?
No, I absolutely agree that we need to have a cohesive national strategy. There needs to be a reset. There was actually a letter that was published yesterday by a group of healthcare professionals saying that we're in that moment where we need to strongly consider resetting. But just to say that, I think those states that are in the red, and there probably are over 18 of them, really need to act now, or else we're going to see even further deaths in this case.
So when we talk about further deaths, then, what kind of numbers are we talking about? Bill Gates spoke to our Andy Serwer saying that 2,000 was the peak when you look in March and April, 2,000 cases a day. Is that the kind of number we're headed back to?
Yeah, I think so. I think definitely Florida, California, we're going to be seeing those numbers. And, I just being in New York City during that time, there was so much that we learned, right? We learned that staying home, we learned that wearing masks, physically distancing, that all works. And we need all of those factors working together. And so any national strategy would need at least 3 of those factors in place. And we don't have that right now. I'm not sure what needs to happen for the administration sort of to pull the plug and to have a national strategy, but we desperately need one.
In the absence, Dr. Blackstock, it seems like there is at least a bill being worked on for mask wearing, and we have seen some, at least discussions going on in Congress, but that is separate from the executive branch. So curious about whether or not that is in any way useful.
Oh, absolutely. I mean, there's a lot that we know now that we didn't know at the beginning of the pandemic here. And so there's a lot of great data out of Europe, out of Asia, that shows that universal masking is quite effective, and even wearing cloth masks. And so, this idea that now, Wisconsin is ordering, mask wearing indoors, I think makes a lot of sense, especially with more recent evidence that's showing that coronavirus is actually transmitted through airborne droplets, right? Not just respiratory droplets. And so, I think any states that have indoor businesses open should highly consider indoor mask wearing.
Dr. Blackstock, throughout this pandemic, we've talked a lot about how communities of color have been disproportionately affected by the virus. We had the CDC release that health equity document last week, not only looking at the issue, but trying to address what actually needs to be done here, providing the guidance. I mean, how effective do you think the CDC has been in addressing this particular issue?
I'm trying to figure out, the CDC definitely has been sidelined. I also will say that the CDC also has its internal set of issues. That health equity document that was released was essentially a skeleton of what should have been a more comprehensive document. Incredibly unhelpful, no real clear process or strategy for addressing the health inequities, but sort of in line what we've seen from so far from the CDC. Again, leaving it up to state and local government to sort of to figure it out.